Hello everyone, this is Dr. Meghna, your dentist. I have planned to introduce you to various syndromes that carry a lot of weightage in your exams, both university and competitive. Let's see a new syndrome with flowcharts and a lot of diagrams in each video. So without wasting a moment, let's get into the video. Must know syndromes in dentistry. Part 6. Edwards syndrome. What is Edwards syndrome? Edwards syndrome is an autosomal disorder caused by an extra copy of chromosome 18. 18q. Q stands for long arm. 18q is affected here. Trisomy 18 or Edwards syndrome. You can see this karyotyping. 18th chromosome has an extra copy. You can see the clinical features, this picture. The head is underdeveloped, the ears are underdeveloped, there's microcephaly, microaortia, there is depressed nasal bridge, hypoplasia of the nose, hypoplasia of the mandible. It's called micrognathia. A patient with Edwards syndrome has several heart and lung abnormalities. Let's see one by one in detail. Let's see the craniofacial findings. You can remember what is highlighted. That would be sufficient. There is microcephaly or small skull. There is microophthalmia or small eyes, cataract, hypoplasia of nasal root, microretrognathia or smaller underdeveloped mandible. There's microstomia, smaller oral cavity, narrow arched palate, cleft lip, and cleft palate. The mandible is underdeveloped, the maxilla is underdeveloped, the nose, the skull, the ears, everything is underdeveloped. Microaortia is smaller ears. Let's see the skeletal features. There is severe growth retardation, short sternum, broad chest, with or without widely spaced, smaller nipples. There is incomplete ossification of the clavicle. This is important. Let's see the cardiovascular features. As I told you, a person with Edwards syndrome has severe cardiac defects. 90% patients suffer from atrial or ventricular septal defect, patent ductus arteriosus, tetralogy of Fallot with overriding aorta. You have to remember cardiac defects in a patient with Edwards syndrome. There is pulmonary hypoplasia. The central nervous system is also affected in almost 30% cases. There is anencephaly, mental retardation, cerebellar hypoplasia. They can ask this Edwards syndrome as an MCQ in your NEET. Which of the following syndromes is trisomy 18? They can give you the options. Edwards syndrome is one. Hope this is clear. If you have any doubts, you can post it in the comments. If you need me to explain any other topics, you can also mention it. I'll be happy to help. Thank you.